Welcome everyone and thank you for joining. My name is Kat and I will be moderating today's session. I would like to begin by acknowledging the ancestral territory of all the Inuit, Métis, and First Nations people that call this land home. We recognize the historic and ongoing impacts of colonization and are committed to decolonization of our systems and ongoing reconciliation. I am located in Kingston, Ontario, which is the traditional territory of the Anishinaabe, Haudenosaunee, and Huron-Wendat, whose presence on this land continues to this day. This session is HCH4, Transitions Out of Care. Following the presentation, there will be a live Q&A period. You are invited to submit your questions for the presenters via the Q&A feature on your screen. It is my pleasure to introduce today's presenters. Our first presentation is Equitable Care Transition from Acute Care to the Community for Those Experiencing Homelessness through Intentional Cross-Sectoral Collaborations. Jennifer Lee is a senior quality consultant and occupational therapist working for Alberta Health Services in Calgary. Sogata Chakraborty is a senior project manager for Alberta Health Services and director of design and quality improvement for COVID Response and Impact Group. He uses the lens of the patients, data, and design concepts to improve and optimize service delivery of care for the vulnerable population. Sarah McHale is an experienced homeless sector leader who has had the opportunity to support housing people experiencing homelessness in both the singles and family sectors. More recently, she worked for Collaborative for Health and Home and was privileged to support these populations at a systems level. Our second presentation today is Discharging from Hospital to Health, Lessons from the Navigator program. Joining us are Fred Ellerington and Alyssa Ranieri. Fred and Alyssa are homeless outreach counselors on the General Internal Medicine Ward at St. Michael's Hospital in Toronto. Thank you to all of our presenters today, and please enjoy the session.